Hi, this is Bill Egan, and this will be a brief audio lecture on an introduction to shadow manipulation. It will be a review for the really ridiculously good-looking PT. So, starting off, we want to look at red flags. So some contraindications, things you may want to be concerned about when performing a shadow manip. First off, is there dark or poor lighting in the room? You need to see the shadow in order to do the shadow manip. Lack of upper extremities. If you don't have hands, you probably can't perform one. Physical contact, you don't want to be touching anything. And we also want to keep in mind Newton's laws of motion and aerodynamic principles. You probably don't want to perform one of these in a vacuum. So some indications for shadow manips. If you're a novice student, you can get some good practice. Maybe you're bored, you have a gig at a talent show or a party trick, or maybe it's just extra credit for an advanced musculoskeletal class. So there are a few CPRs. The one I chose was validated by Egan and colleagues. There's a list of 5 criteria. The first one, height. Height must be greater than 17 centimeters. Age, greater than 5 months, 3 weeks, and 1 day in the womb. Symptoms present longer than 700 nanoseconds. Having a bald head. And also, you need to be a cocoa butter user for at least 2 years for those nice, soft, supple hands. Sensitivity? It's kinda sensitive. Specificity? Sorta specific. It's important to note that if there's 3 out of the 5 present, there's a positive likelihood ratio of 6.1. 4 out of the 5 present, likelihood ratio is 24.8. And if 5 out of the 5 criteria are present, the likelihood ratio is 50,000. Finally, in a study by Burns et al., this was a quadruple-blind meta-world peace analysis of shadow manips, being the experimental group, versus people manips, which was the control. There were 2,014 subjects, and in conclusion, shadow manips were found to not only be inferior to, but henceforth, albeit less effective than, notwithstanding less adherence, although greater to regression of the mean and kurtosis, just all around bad practice. The bottom line, it doesn't work 60% of the time. Thank you for your attention during this audio lecture, and I'll see you in class.